My dentist has advised me to floss. What is that and how often do I have to do it?
So flossing basically is nothing but removing the same plaque which I was talking to you about from in between the teeth, because our normal brushing is, the side to side strokes, and upper and strokes always cleans only the outer surface and the inner surface. But what about the areas in between the teeth? So then you require a device. It's called an interdental aid, and one of the interdental aid is a floss, where you insert the floss interdentally between the two teeth, gently, without harming the tissues, without hurting the tissues, and you remove basically the plaque from the interdental areas. Like floss, you have other interdental aids which are available, maybe like a little interdental brush, and these are depending on the size of the we call it embrasure space, that is the space between the two teeth. So the space is wider, obviously a thin floss would serve no purpose, and you go for a little bigger interdental aid like a brush. But if you have no spaces, if you have a tight contact, then a dental floss is the ideal interdental aid to use, and is recommended by dentists for all patients to practice along with their brushing. And I would also add here about mouthwashes. Mouthwashes is again something which is advocated only during the treatment phase, and should be used maybe to a maximum of say 2 weeks, and not used maybe as a regular add-on along with the brushing, because it's only indicated when you have a problem, and once the problem gets sorted out, you need a regular mouthwash on a regular basis. But yes, brushing and flossing can be part of the regular home maintaining regimen for everybody to maintain healthy gums. Well, brushing once a day is of course mandatory. When you brush once a day, obviously you need to floss once a day. In certain patients, yes, where there is a need, there's a challenge, like for example, a patient with crooked teeth would need to maybe brush twice a day. So flossing maybe could be done once a day or twice a day, but brushing definitely mandatorily once or twice a day is recommended, with a good toothpaste and a good brush. Many patients ask what is a good paste and toothbrush. Basically, any paste which basically is refreshing, which has got a lot of foam, which has got a pleasant taste, can be used. And of course, there are certain pastes in the market which have certain ingredients which are labeled as anti-plaque, can be used, which contain triclosan as an ingredient, and they have proven anti-plaque effect. So if you're a patient of gingivitis or periodontitis, you could use any paste containing triclosan over a good period of time. Otherwise, for regular use, anybody could just use any paste which gives up enough foam and is pleasant to taste, and use a good brush which is not too hard, which will cause damage to the teeth and the gums. But a medium good brush from a good company should add to your armamentarium of maintaining good oral hygiene.